Yes, I'd like to start by expressing sympathy with all who are sick and with our deep condolences to all who have lost loved ones in the last weeks. Just on the debate we had at the start, the accountability of government in a national emergency is more important than in normal times, not less. Allowing the voice and the concerns of constituents to be heard is more important in a national emergency than in normal times, not less. I am open to the idea of remote meetings, but the Dáil should meet next week. I want to raise the issue of tens of thousands of workers who continue to be called into work even though they feel their work is not essential and that company profits are being put before workers' lives. Workers like the workers at Ferrero in Cork who continue to be called into work to make Tic Tacs. Workers like the workers at Dupuy in Cork who continue to be called into work to make artificial hips and knees, despite the fact that elective work is cancelled, competitors have shut down, and product is being stockpiled for future use and profit maximisation. Workers who find themselves in such situations do have options, however. Relentless social media campaigning by the Unite Trade Union's construction branch forced the closure this week of the construction site at the National Children's Hospital. A trade union campaign to get workers to contact the Health and Safety Authority en masse forced the closure of Stryker at Carrigtwohill in Cork. In other countries, workers have shut down their workplaces by walking off the job. It may be only a matter of time before that starts happening here. If workers in such situations want help and advice, I would urge them to contact the Workers Speak Out COVID-19 Facebook page, where I think they will find good help and advice. I welcome the fact that the state will have the use of facilities of 19 private hospitals for the next 3 months. I don't believe that the private hospitals, like Dennis O'Brien's Beacon Hospital, like the Heritage Clinic, the Blackrock Clinic or the Bon Secours chain, should be compensated for this. Nor do I believe that a two-tier health system should be dismantled this week and then re-established in 3 months' time. But rather than develop these points in the limited time available to me, I simply want to ask a question. Why is it that this deal between the state and the Private Hospital Association is, for the most part, a secret deal? When the state does a deal with workers and their representative organisations, the details are usually published online. They are published in the newspapers, they're subject to scrutiny and public comment. But when the state does a deal with billionaires and wealthy corporations here, the details are being kept secret. Why? Is it because the deal hasn't been signed yet? Is it because the Hospital Association are insisting on commercial secrecy? Is it because the government think that there may be public criticism of the sums involved? The details of the deal should be published immediately, and the secrecy around it should stop. Ceann Comhairle, extraordinary powers have been granted by the Dáil to the state, and they are now in evidence over this 2-week lockdown. I believe that the overwhelming majority of the population are complying and will comply with restrictions in the interest of public health. We should, however, not blind ourselves to the abuse of COVID-19 special powers in other jurisdictions, nor to the abuse of special powers in this jurisdiction in the past. This situation needs to be monitored very carefully by organisations that defend the interests of workers, young people and oppressed groups, and by those who defend civil liberties. As a workers' representative, I will do my best to help monitor this situation in the weeks ahead. In conclusion, I want to raise issues I've been asked to raise by 2 groups of workers. First of all, the student radiographers. They went into the hospitals on Monday for their clinical placements. They'll be doing chest x-rays for COVID patients as part of their work. Many have had to give up accommodation for health and safety reasons. Many have had to give up part-time jobs. They receive no pay for their placements. They receive no travel allowance for their placements. They should be paid. And finally, the bus drivers at Broadstone Garage have been involved in a dispute with Bus Éireann for the past few days. Why? Most of the buses do not have protective screens. The drivers have been stopping at the stops, asking passengers to stand back, getting off the bus themselves, allowing passengers on and then boarding the bus again, but without collecting cash. Rather than entering into a dispute with drivers such as these, frontline workers, the public transport companies should follow the example of the drivers and waive fares for the duration of the crisis.
Thanks.